Dr. Beck, I know you do lots of sports injuries, which makes a lot of sense for a physical therapist and somebody who knows how to test nerves to see where it is. Tell me, a little kid playing soccer, twisting his leg, twisting his ankle, or for that much. In fact, I was skiing the other day, and for the first time in, I think, many years, I went off the thing, and I somewhere along the line, my shoulder didn't feel too good for not too long, frankly. It went away, right? But so let's assume it's more, there's this, at least to me and many people I know, there's always this confusion, hot or cold, when you have sprained your ankle. When is it like, okay, it's a sprain, it will go away, there's not much we can do, or we can do something at home, or like, you better go and see a doctor. What's the difference between sprained and broken? How can you see that? How can you think, at least, you maybe get a good estimation as being the patient, so to say, or the mom for that much?
Well, frequently you can't tell, and sprains sometimes hurt worse than fractures do. So I have a saying, if in doubt, check it out. If you are concerned that there may be a fracture there, just go ahead and see the doctor and get an X-ray and sort it out and see what's happening. Because again, you can't. We don't have X-ray eyes. We can't look inside the joint and see what's going on there. And pain by itself really isn't a great indication, because again, I've seen sprains that have caused much more pain than actual fracture or broken bones. So
in fact, I've heard that from when I was a kid. Fractures kind of like, well, they might hurt, but not so much. If it's really hurting, it's just strained. What a condolence that was.
Yeah, sprains can be awful. They can swell up. You can't walk on them. They can just really be a problem. And the doctor, there's a set of rules that the doctor will go by to determine whether you need an X-ray or not. But again, if in doubt, check it out. If you think you may have a fracture or a serious problem, go see the doctor, because even a sprain can be bad. You can tear ligaments. You can have problems that may actually need surgery. So without seeing a doctor, you won't know, and things could get too far down the road where they really are a problem. I want to get back to the point you were talking about, ice and heat. This is a common misconception I see in my practice, particularly for sports injuries or sports problems. It used to be people just said you use ice for the first 24 hours or 48, and then you go to heat, and then you never use ice again. And I want to tell people that's really not true. You can always use ice. Ice is very, very effective. And ice does a couple of things. Number one, if it's for a sore muscle, the muscle can't spasm if it's cold. It actually will shut down the pain nerves, and it can also decrease inflammation. So ice is always effective, but you definitely want to get the ice on for the first 24 to 48 hours of an acute injury. Now, after that, you can alternate ice and heat. So both are useful, but ice is always good. So don't neglect ice if it's been a week or so after you've hurt yourself.
I see. So the reason one puts on ice first, kind of as a big rule of thumb, is so that because a swollen body part has obviously, the reason it's swollen, it has a lots of blood there being stuck, and it pushes on the nerves and on the wherever, right? By simply being overloaded. So ice cools it down, makes it go away from there, makes it shrinking, because if you freeze things, usually it gets a little smaller, so that kind of takes away the pressure of the pain, right?
Well, I think one of the main ideas behind initially using ice is to minimize swelling in the joint or injured area there, because it will decrease the blood flow into that area. So I think the major thought is to keep the swelling down, because, gosh, if you've had a strained ankle or knee and when that thing blows up, you know how bad it hurts. So the less swelling you get, the better off it'll feel. And
it swells less with ice simply because the ice keeps the blood away. It makes it shrink in that area.
It decreases the blood flow. Yeah. The blood vessels constrict. If your fingers turn white when they get in the cold, that's because there's no blood flow there. And so that's what you're doing with your knee and ankle when you put ice on. You're decreasing blood flow to that area so that you're going to decrease some of the swelling.
Right. And then after that kind of major swelling problem is kind of like gone, but there's still the strain there, then what you're saying to do alternative cold-hot kind of stuff actually will do just the opposite. It will circulate the area, right?
Yeah, and what happens if you put heat on later is that it gets the kind of nasty chemicals out of that injured area by increasing the blood flow, and it sort of washes out these enzymes and chemicals that get in there that cause pain. So heat can be also very effective, but usually at a little bit later stage in the injury.
Mm-hmm. And what about the alternating of it, like relatively quickly, hour this, hour that, or even less, or something like that?
I don't think there's really any firm science to how to do that. I just recommend people sort of try it and see. Some people find that ice all the time is the best thing. Some people find heat all the time is the best thing. And then some people actually alternate and find that one helps at one time and one helps at another time. So some of that's just dependent on you. For example, if you have a strained back, a back strain, people frequently will alternate using heat or ice depending on what feels good at the time.
I see. Because I do that with when here and there I have a shoulder, it's soreness and et cetera. And I actually do that almost, actually I don't do it almost, I do it literally all the time. I do hold it hot and cold alternative showers. And, so I, a minute cold, a minute hot, or maybe even 30, 40 seconds hot as I can stand it so I don't, burn myself, and as cold as I can get it, especially living in California. Sometimes I feel the water isn't cold enough, I do feel vigorated, but I have used it also for, let's say, that little shoulder pain, and then I just go hot and I move it, and cold and I move it, and do that 5-6 times, and usually 2 times, 3 times, like over a couple of days, like morning and evening, 4 times. Usually it helps quite a bit versus not doing it.
Yeah, it really varies and it depends on the person. But again, I don't think there's really any hard and fast science on which to use when. So, try it and see what works for you.
Okay, good. Well, that's training a muscle and basically, so there is no real, obviously, looking at it and say, oh my God, this is broken or this is only sprained. It's just, even you wouldn't be 100% able to tell that without an x-ray. Am I right?
A lot of times no, and I'm usually surprised when I think it's broken, it's not, and when I don't think it's broken, it usually is. So I got to get an x-ray.
Well, all right. Thanks a lot.